and welcome back to the Mommy and Baby Show. I'm your host, Masi Tetu, and this is episode number 3. So today's topic is one that is for the books because every pregnant woman has gone through this. It's a stressful situation whereby you don't know which hospital to pick, what are the factors to look out for, and for that main reason, we have hospital administrator, Madam Rose, who will be taking us through this entire topic and explaining in detail what we should get to know. Karibu sana.
Okay, thank you so much, Masi, for having me today. My name is Rose Wangari Kariuki, and I'm the hospital administrator at FH Kiambu Road. We are located along Kiambu Road at third floor of Brick Mall. And we are a 24 hours facility offering both outpatient and inpatient services, and basically any other service that is within the scope of a level 4 hospital. We are just one of the 11 branches of RFH Group. We have a branch in Syokimau, Pacific Mall. We have another branch in Imara Mall. We have another branch in Komarok at K Mall. And then, of course, we have another one in Tala Town, opposite Tala Police Station. Then we have our main branch, which is our headquarters, RFH Specialist along Kagulo Road. Next to it, we have the State of Art Cancer Center. And then our mother branch, which is Roy Family Hospital, next to Quick Mart. On this other side, we have Ruaka branch, which is our neighbor. And we have another branch, I think the last one, which is along Eastern Bypass, RFH Ruiru.
Okay, great. That is really good to know because for this particular topic, we're looking at choosing a facility. So with that being said, it means from wherever you're stationed or wherever you're living, it means there's a facility you can go to, rather there's an RFH branch you can go to. So diving in straight into the questions. So I'm a new mom, no, I'm not a new mom, but a mom-to-be, and I'm looking to choose a facility. What are the factors I should be looking for when I'm selecting a hospital?
Okay, for mothers and families looking for a facility, probably for maternity services, there are several factors that they need to consider. Among them is location and accessibility of the facility. How easy is it to get to the facility? How are the roads? Because at times you find that a mother gets into labor at night, and you also want to understand if getting to labor at around 3 hours of the night, how do I get to the facility? Are the roads easily accessible? Another issue is the cost and quality of maternity services. Again, you want to go to a facility that you'll feel comfortable with the care that will give you. You also want to look at the staff that are there, because you can have a facility that is well structured, but again, the staff, they are not friendly or supportive. We understand that maternity issues, childbirth are usually very special and delicate moments of a family. So you need to have people who will walk the journey, who will help you to walk the journey. From sometimes we start from prenatal care, antenatal, during delivery, and of course postnatally. So again, you also want to look at factors such as insurance coverage. Say you are insured by a certain insurance, you want to visit that facility to understand whether they accept that particular insurance and what are the possible inclusions and exclusions, as well as issues to do with hospital reputation. With the current advancement in technology, we understand that the millennials and the Gen Zs, which are now, they are in their reproductive stage, they are more glued to the internet to get client reviews about a particular hospital. If a review is negative, that probably that patient is not going to visit that particular hospital. So again, brand reputation. And I believe for us at RFH, we are a reputable brand. And we always focus on offering standard and standard quality care to our mothers.
You've mentioned something about looking at accessibility. So for instance, I live around Ruaka, but at the time when I'm going into labor, I'm not close to Ruaka, and I've chosen the branch there. and probably I'm now closer to a different RFH branch. Will they still include me regardless of where I had chosen initially?
Yeah, they
to
will.
give birth?
They will include you because I think we are one and only thing, and we offer similar services.
Also, it's standard across
Yeah,
all
it's
branches.
standard across all the branches.
Oh, that's really good to know. So now that we've partnered with RFH, what would you tell a mom would make their stay comfortable, or what makes RFH mommy and baby friendly?
Oh, there are several factors. Of course, as I mentioned earlier, you want to look at the supportiveness and the friendliness of the staff that you're getting there. For you to have friendly staff who is supportive, that itself in itself makes that facility mom and baby friendly. Again, during labor, you want to have staff who will walk you through the whole journey from onset of labor to delivery, then post-delivery. At this particular moment when a mother is in labor, usually they get confused. And I want to quote mostly the first-time mothers. Sometimes they are confused, they are anxious, they do not know what to expect. And so when you give them someone who understands what it takes to be in labor and what is required of this mother, then that mother would, of course, feel a bit comfortable and would term such a facility mom and baby friendly. We also offer lactational counseling, and for us to be able to ensure that our babies post-delivery are getting enough, and this way we are going to prevent issues such as dehydration, neonatal sepsis, jaundice, and the likes. Again, for a mom and for a hospital to be mom and baby friendly, we have to involve the family. So a facility that involve the families in decision making. I would term it as a facility that considers the welfare of the mother and the welfare of the baby. Another another factor that makes a hospital mom and baby friendly is provision of respectful and compassionate care through, of course, qualified and experienced staff. For us, we have professionals. We have specialized doctors such as obstetric gynecologist, pediatrician, anesthetist. Should there be a need for us maybe to move from a normal delivery to C-sections, we always ensure that we have those people on standby so that we don't waste a lot of time in case we get into an emergency. Again, another factor is warm and supportive care and health education for postnatal mothers. These mothers need to understand what type of care they need to accord their babies once the baby is delivered. And this will include how to top tail a baby, how to do cord care, how to basically take care of the baby, how to ensure that the baby is well latched. And I feel this is usually a challenge with first-time mothers. You know, for a mother who has never breastfed, they sometimes become reluctant. They leave you with the baby and would tell you, hey, sister, kindly just sort out this issue. And they will probably tell you to go for a formula. But when you find a professional nurse or a doctor who is trying to reject the inclusion of unnecessary formulas in the baby's meals in terms of the neonate, that would click and would tell you that is a person who is actually thinking of the well-being of the baby in terms of boosting immunities, because we understand that breast milk is very, very crucial, and especially during the first times of the neonate. Again, for a mother who has who doesn't have optimal milk letdown, trying to how they educate her on what to take warm fluids, there are medications to take, what you need to do, maybe buy a pump to ensure that the baby gets enough. So that alone can just tell you that this is a hospital that has mom and baby in mind.
That is true. Yeah. So you mentioned that you offer lactation counseling. This comes after you've given birth.
But usually, it may come after post-delivery, but usually we start it early just to prepare the mother in advance.
Okay.
We started the counseling much early enough so that when the mother delivers, she at least knows where to pick from. It doesn't become like something so new to her and she does not even understand. And at that particular moment when you've given birth, you're tired, you're confused, you don't know. Maybe the baby is crying, you don't know what to do with the baby. So even that particular time when I'm coming to give you lessons, you might not even understand what I'm saying.
That's true. So other than the lactation counseling that you give prior, do you offer any other, let me say, like classes, like prenatal classes, or offer something like someone like a doula? Do you offer any other classes while you are pregnant before you give birth?
Yeah, yes, we do. Because the moment a mother visits us for antenatal care, and we really encourage them, the moment they understand or feel like they're pregnant, they should immediately start their clinic. Because during clinic, you're able to health educate them on several and most essential factors, like importance of supplements during pregnancy, and especially this plays a key role in organogenesis. That is when the baby is developing. What they are required to do. Maybe if they come from a malaria-prone region, they're supposed to take those malaria supplements, how they're supposed to cover themselves, how they're supposed to eat, what diet are you supposed to take when you're pregnant, what care are you supposed to take for yourself when you're pregnant. We also try to, as we near the end of the journey, we want to give them to understand what is their individual birth plan. How prepared are they psychologically, emotionally, financially, and how is the family ready to welcome this new being that is being brought to the family as an addition. Again, we also want to just prepare them on what to expect and understand. As a mother, if I'm a first-time mother, am I expecting a normal delivery? What are the possible reasons that can make me not deliver normally? What are the indications, the danger signs?
So you've mentioned you educate these moms throughout the entire pregnancy, So does that mean every single time I come for the clinic visit, I get to be educated on something?
Yeah, you get to be educated on something and reminded on what you were told during the previous visit.
So speaking from experience, whenever I was going for clinic, sometimes you find there are others also attending clinic at the same time. So will I still get that individualized attention when I come for my visit at RFH? Or is that dependent on our clients for the day? We are too many, so today we will not handle that. We will do it next time when you come for clinic next month. Or is that something that is standard every single time I come for a visit?
Okay, I think I forgot to say when I was starting that at RFH, we offer individualized maternity services.
In the previous question, you answered something about RFH being well equipped to handle any sort of emergency that may arise. So is there any other factor? You mentioned that you have pediatricians on standby, you also have gynecologists on standby. So that is every other time at any other branch, I know that should anything go wrong with my normal delivery and we've now turned it into an emergency CS, that I can be assured that I have those people on standby all the time?
Yeah, that is correct, because the sensitivity of maternity services in any facility and even in other hospitals makes them to have an emergency response team. And in this sense, you'll find that we have a theater that is within a close proximity with the maternity unit. If you have walked around our Kiambu Road branch, you'll be able to establish that our delivery is just opposite theater. This is to say, in case we are not able to deliver baby normally for some reasons, for some complications, then we're able to rush you straight to theater. And as you have also said that we have our gynecologist, our pediatrician, and our anesthetist on call, and they are within the facility. Again, if you look at our headquarters in Roy, along Kagudo Road, that is where we have a well-equipped NICU, that is neonatal intensive care unit, as well as an ICU. Or we may not be able to offer NICU services at RFH Kiambu Road, being a level 4 hospital. We have our ambulances on standby. They are usually stationed around Kiambu Road and also in Ruaka. So should there be a need or a need arises for us to take you or your baby for intensive care unit, then they are readily available. Again, our close proximity with Kiambu River 5 Hospital. In case we need blood, maybe there's a PPH, APH, we are able to send our riders and our ambulance who act very fast to bring us blood. But this does not mean that in our lab we have no blood on standby. Anytime we are taking a mother for delivery, be it normal, elective CS, or emergency, we always have a screened blood ready, just in case things go south.
So, as you've mentioned, is that the same procedure or is that the same standard across all branches?
Yeah, it is the same standard across all our branches.
Okay.
Yeah.
So, as a first-time mom, and I'm looking for a hospital to deliver in, and now specifically if I'm coming to RFH, any of your branches, what are the questions I should be asking when I'm going for this maternity tour?
Okay, I want to say that I'm privileged to have taken several mothers for maternity tour at our RFH branch. And the moment they get into a facility, their first station or their first center will be the front desk or desk, where of course they want to seek to understand what are the charges for either of the deliveries, either normal, elective, or emergency C-section. And another issue now, when you're bringing them to see your ward, they want to understand what are the possible pain management methods that you would offer me in case that I come in labor and I'm not able to tolerate pain.
Okay.
The other question would be when I'm at a labor ward where I'm about to deliver, is my partner allowed to be in? And of course I would say yes, because we want you to be supported emotionally, psychologically, and encouraged throughout the labor process. Again, they want to ask what probably do I need to pack? Do I need to pack in my baby's bag, my personal items? And for that reason, you have someone who will guide them through as to what they need to include in the baby's bag and their personal items. Again, some will be anxious and curious to know whether we have emergency responsiveness in the event that we get into a complication. Do you have an NBU? Do you have an NICU? Where would you take me? If you do not have them here, then how is your referral system? Am I safe being in RFH, Kiambu Road, or any other branch? Yeah, so I believe those are some of the questions that they would love to know.
Okay. You mentioned that you allow partners to be with you as you labor. Also, once you're also going to delivery in the theater, not theater, but if you're having a normal birth, it's still normal birth when you're giving birth normally, vaginally. So are you allowed to have your partner in with you at that moment?
Yeah, we do allow, and but we give a disclaimer. We want someone who is there to support, and someone who will be able to withstand the trauma that comes with delivery. Majority of people would feel uncomfortable, but I've come to realize nowadays men are so involved in the birth process of their babies, and it also adds value to the woman, and they're able to respect these women, especially having seen how hard it is to just deliver a baby.
Sure.
Yeah.
So men, if you're listening, please make sure to take your wife, your girlfriend, go with them, see how they labor, support them. It shows you how hard we work.
Yeah, true.
Anyway, so you mentioned it's a question obviously all moms will have, the delivery charges. This usually vary if I'm having a CS or if I'm having the normal delivery. How are your charges and why do they differ?
Okay, for the charges will of course differ because if you are looking for a delivery per vagina through a midwife, that again will cost lesser than a normal delivery that is gynae assisted. And knowing that for a gynae assisted delivery, that's a specialist, that's a consultant who is coming to work with you. And of course, the higher you go, the cooler it is. So of course you have to chip more or dig deeper into your pocket. For a normal delivery, usually we do not. It's not usually does not involve a lot of work as it is with a C-section. For a C-section, you need a qualified surgeon. And of course, at RFH, we give you the best. We give you obstetric gynecologists, people who are skilled, went to school to study just that. And again, we also board in a pediatrician who is there to receive the baby. I just want to tell you, for normal, you are giving birth normally.
Yeah.
No one is cutting you. For a C-section, you need to be prepared for theatre. Of course, there are anesthetists, there are drugs involved.
Yeah.
There's a procedure, a whole lot of things that goes on there. And you cannot compare even in terms of cost. And for a normal delivery, once you deliver, it give you a maximum of 24 hours for us to monitor you. For a C-section, we are retaining you for at least 3 days. At least 3 days of antibiotics, 3 days of pain medication, and 3 days of wound care. So that makes it different with a normal delivery. Yeah.
And do you offer elective CS?
Yeah, we do. Yeah. You can just walk in if you have your EDDs. If we've not walked the journey with you prenatally and antenatally, you can just walk in and book a C-section with us.
Oh, so there are no, because I've heard that usually it's dependent on perhaps maybe you've gone beyond your due dates. Is it for anyone? Like I can choose, I don't want to give birth, I don't want to have a normal birth, I just want to do CS from the get-go. Is that allowed? I can just come in and book?
Okay, I would say yes and no. I've given you 2 options, yes or no. Because if you've never given birth, this is your first time baby, we always want you to try normal delivery, unless there are indications for you to go for a C-section. And for this reason, when you are a primary gravida, we cannot allow you to book for an elective CS. Elective CS will have indications. Maybe you have something we call CPD, you have malpresentation, the baby is not well positioned in the uterus, and that would make it hard for a baby to be delivered normally. So for first-time mothers and at RFH, we always give you a chance to labor normally, unless there are indications. And these indications must be something that you've discussed with your gynecologist. Of course, when you are walking the journey, much as you're seeing a midwife all through your antenatal clinic, at least towards the end, we want you to book 2 sections with a gyna, for the gyna to ensure that everything is okay, and to let us know, we are going for a CS because of this and this and that.
Yes.
Okay.
So also when we're discussing the questions to ask when you're doing your hospital maternity tour, you mentioned moms will ask what are the pain, how you help moms during labor with the pain management. Can you maybe go deeper into that? Like how do you offer support for moms with pain management?
Okay, for pain management for those mothers who are laboring, we have 2 methods. We can use the natural methods, pain management method, and we can choose to go medical. We can use analgesic to just dull the labor pains, but not to stall labor. There are some myths there that when you give analgesic during labor, they tend to stall labor. Like this is to mean that they prevent progression of labor, but usually that is not the case. What they do, they dull the labor pains. For natural pain management techniques, these are the normal relaxation techniques, breathing techniques, massage. We walk the journey with you. You'll find even the question of you having a partner or your birth companion. We try to encourage them when these contractions get more intense, do a massage on the back. And this touch method will help the mother to ease the pain. It might not make the pain go away, but at least it becomes manageable. Other techniques, we have the birthing ball. You come with a ball, you're able to do some exercises, but of course with the help of a midwife or a qualified medic. Yeah.
So do you offer epidural?
Yeah, we do. Sorry, I forgot to mention that. We do offer epidural, and this is usually done by our anesthetist. If you are told you're not able to withstand pain, then we can go that direction. And epidural more, so it's just the methods that I mentioned, use of analgesics to dull the labor pains. Yeah.
So is that something I choose beforehand? Like, can I opt to have as a birth plan? When I'm walking the journey with you, then I say, because I've heard from people it's really painful. I'm very scared. I'm very nervous. Can I choose from the get-go and say I would like to have epidural when my time comes? Or
Yeah, this is something you can decide beforehand, because
Yes.
it also comes with cost implications.
Yes.
Much as you're doing a normal delivery, there will be extra cost for it. So you also need to be prepared for it. And I've seen our mothers, those that want to do epidural, they just book in advance. You can just prepare yourself because, you know, maybe you've ever gone through labor, or maybe this is a second baby and you do not want to go through the pain that you went through with your first pregnancy. Yeah.
You mentioned also that the labor pains are dulled when you use the
Analgesics.
Yes.
Yeah.
Does that mean I will be in labor and not know that I'm in labor because I feel nothing? Is that the case whereby you just happen to already your baby is coming and you did not feel a thing? Because I've had stories of people who give birth midway. They were in hospital, yes, but maybe they had gone to the loo or something, or so, like it happens without you fully being aware because you're not feeling anything. Does it work that way?
Okay, for us to give analgesics, you can only treat what you have symptoms for. I cannot give you analgesics if you're not in pain. So first of all, you must be in pain for me to be able to calm that pain. So of course, you'll know you're in labor.
Yes.
And again, when you're in a hospital setup, you have a midwife who is working with you, who is giving you new support around the clock. You may not feel the pain, but I'm able to see the contractions. I'm able to do vaginal examination to understand how far we dilated, how are we progressing. So you might not feel the pain, but the labor process still progresses. Yeah.
Okay. Then also it's a question I hear with moms. I've seen this on social media. Usually we ask opinions of other mothers, which is the best facility to give birth at, how are the staff, were they friendly? Because we have that fear that when you go here, apparently utaongeleshwa vibaya, blah blah blah. So as a first time mom, to alleviate those fears, and I'm here, how can I tell that the staff staff at RFH are qualified? How can I tell that they are caring? I can't, because I've not been here with you throughout the whole journey. But is there a way I can pick out?
When you're walking into a health facility, you're able to tell whether staff are qualified by the way they handle themselves, how professional are they, the way they approach you, and the attitude towards the patient or towards you as a client. Again, you're able to tell by the kind of questions you're asking and how well they're answering them. For someone who is qualified, that person is able to answer basically any question related to your health condition or related to maternity services in the best possible way. So I also feel when you walk into a facility such as RFH, you want to understand, is it an accredited hospital? Apparently, you cannot have such a facility along a busy highway that is not accredited. I believe with accreditation comes experience, comes qualifications. We cannot hire people who have not gone to school. We cannot hire quacks. We usually verify, and we are very keen when we are doing our hiring of our medical staff, particularly to our branches, because remember, matters health are usually very sensitive. And also, again, we do not to get ourselves into trouble because of mishandlement of a patient, because someone is not skilled enough to handle a particular issue. So basically, by the way that particular staff will present to you, and the way they will address you, and the way they're able to answer questions related to the care that you are looking for.
I believe insurance plays a very important role when it comes to selecting your hospital of choice. When it comes to RFH, how important is it to have insurance, or what role does it play when I'm choosing my facility of choice?
So at RFH, we understand that childbirth is one of the most special and delicate moments in a family's life. And for this reason, we have designed our maternity services not only to be safe and reliable, but also to be warm, individualized, and mom to baby centered. I believe families choose us as RFH group because we combine modern medical expertise with compassionate care, and we have a team of experienced obstetric gynecologists, pediatrician, nurses, midwives, MOs, and other members of the clinical staff, as well as non-clinical staff members. So with this, I believe we offer a safe environment for maternity services, and that is equipped for both routine deliveries and high-risk deliveries. As I mentioned earlier, we have a very efficient emergency response team, starting from our ambulances and for the fact that we have NICU and ICU at our headquarters. I also feel like just the other day we established a program that is factoring all the babies born at RFH, regardless of the year. This is to say that we always give back to the society, and we reach out to the society and to appreciate those mothers that gave us, that trusted us with their pregnancies. And for that reason, it's a program that will run for quite some time, and we are looking forward even for any other person to come and join us in. If you're out there and you have your mother, you have your sister, you have a relative or a friend who is expecting, kindly refer them to RFH. And I will also want to be self-centered to say that just refer them to RFH Kiambu Road. Thank you.
Okay, so you've had it first. The place to be is RFH, and as she said, RFH Kiambu Road. Thank you so much for making the time to be here. We appreciate your time and we appreciate you, and you are most welcome at any time. So that concludes the episode for today. I hope, as usual, you have been empowered, you have been informed. If you haven't subscribed, please remember to subscribe. Give us a like. If you have any questions, please put them down in the comment section. We'll be sure to reach back. We love to hear from you. And until next time, it's been a pleasure. Bye-bye.